Bruno Bueno, Director of the Peruvian British Business Chamber.
Buenos días. ¿Me escuchan bien todos?
No.
A ver, buenos días. ¿Todos me escuchan bien allá? Bueno, estimada doctora María del Carmen Calle, presidenta del Organismo Andino de Salud. Estimado doctor Leonardo Rojas, director ejecutivo de la Dirección de
Secretary of Health,
amigos y amigas.
dear friends,
Los saluda Bruno Bueno,
I'm
director de
Bruno
la
Bueno, Director of the Peruvian British Chamber of Commerce. I'm very happy to participate in this session that I'm sure is going to be very useful and in great interest. In the coming minutes, we'll have 3 presentations by British companies, two of them focus in different areas, very promising, very powerful in terms of digital health. The United Kingdom, through the British Embassy and the Peruvian British Chamber of Commerce, would like to show the different uses of digital tools and artificial intelligence to reinforce promotion of health in Peru. These tools have shown to be very useful to overcome geographical challenges, access, social, and other aspects. All of these major challenges are very present in the different regions of our great country. We think that Peru can benefit from the progress made in this field, and we reaffirm our commitment and of our companies to reinforce the effort of Peruvian institutions, especially through the exchange of experiences in terms of improving practices and joint effort. Welcome again, and thank you very much.
Bueno, en primer lugar vamos a dar inicio a la empresa
We're going to start with Inavia. This is a company specialized in generative artificial intelligence applied to medicine. We welcome Michael Wilkinson and Peter Sajota, creators of this software, the Avatar, in the project of empathy in Peru.
Thank you, Peter. Hello, everybody. My name is Michael Wilkinson. I'm the founder and CEO of Inavia, and Peter is our chief scientist in artificial intelligence. And I'm going to present our project called Empatia, which we launched in Peru with the Tecta Hospital and the embassy. Next, please.
Bear with me. Yeah.
Thank you, Peter. The project was called Empatia, and it ran for just over a year in partnership with Detecta Clinic, which conducted a clinical trial looking at the use of our Avatar technology, which is a remote patient support service for patients who have cancer, breast cancer, and the treatment for these patients. And I'll show you some of the results quickly now. Next, please. The key findings of the use of the Avatar technology was that the technology can be useful for patients who are suffering from pain, especially pain just before the surgery and pain after the surgery. But there's definitely a need for further improvement in how pain is managed remotely. Another area that's important in our work was around depression and anxiety. It actually increased after the surgery, and this is an area for improvement where mobile technology can support patients who are away from the hospital. Next, please. And another finding that was interesting was the amount of comorbidities. Many of the patients who have breast cancer also have other conditions such as diabetes, hypertension, obesity, and so on. And so there needs to be an approach for personalized healthcare at scale that can support patients who have comorbidities. And the fourth point, which became very important, is around patient agency, essentially patients feeling empowered or having a sense of control. And the technology has potential to support patients so that they have more control. Next, please. The interviews from the patients revealed that patients saw most benefit around medication reminders and also help with medication or medical appointments. And the third point that became important was providing information, entering information so that the clinicians who are, say, hundreds of miles away can actually see how the patient is doing with regards to their care plan. Next, please. And the other point that came up in the qualitative work was around patients seeking information about medicines in their records, and also in Peru, and Peter will talk about this, they're wanting information about the use of plants and herbs and alternative medications and the impact that might have on their treatment. Next, please. Now, the issue that we have in Peru, but indeed all over the world, is how to deliver highly personalized healthcare at scale when the demand is ever increasing. And one way in which that can be achieved is through the use of artificial intelligence to help to deliver personalized healthcare for all. And I'll hand over to Peter now, and he'll talk about our approach and what we've actually created in Peru using advanced technologies around artificial intelligence. Peter?
Great, thanks, Michael. So now I'm going to talk about some of the work we've been doing in frontier AI technologies. What we're doing is we're building on some of the generative AI models that, like ChatGPT and similar models that you may have heard of. And we're also working in partnership with Microsoft and taking that into the healthcare domain to build something that's genuinely new and innovative and relevant to work that's being done in hospitals. So everything that we do is about learning from and co-creating with the clinical teams at Detector Clinic, at other hospitals in Peru and elsewhere in the world. So what we do is we start by asking, what benefits are these healthcare teams seeking? And what benefits are their outpatients seeking? Now, what happens is when the patient is discharged from hospital, the doctor gives them a care plan, telling them what medications to take, giving them diet and exercise advice, and so on. But also on top of that, many healthcare bodies recommend that the doctor should also work as a team with the patient. This means that doctors should seek to understand the patient's own goals for improving their health. Doctors should fully address the patient's own concerns and worries about their health and about their treatment. Doctors should also help patients to educate themselves about their condition and about the necessary treatment. And in this way, doctors should establish a relationship of trust and shared understanding. And this is called concordance in the medical literature. And when you have this relationship of trust between the doctor and the patient, then you're more likely to get good adherence because the patient has bought into the care plan, as it were, and they're more likely to continue with the treatment, which is otherwise a big challenge. However, in practice, as we know, doctors have very, very limited time with patients during the appointment. And anyway, outpatients need the support when they're about at home, at work, and about their everyday lives, and not when they're in the hospital. And another point is that people are becoming more and more used to digital services when they're doing their online shopping, grocery shopping, when they're ordering an Uber cab, whatever, we're booking a holiday, whatever it is. So their expectations are rising about what digital technology can deliver in healthcare services too. So these are some of the kinds of the requirements that we find across the board. And you can already see that these are the kinds of challenges that remote and personalized digital technology can maybe help with. Now, we've been working very closely with Detector Clinic and with hospitals in Peru. And what we've learned here is that there's some very specific needs as well. Firstly, hospitals like Detector have their own specific treatment protocols and their own patient guidelines. These might differ from other countries, maybe even from other hospitals in Peru. A second point is that about 40% of the Detector patients live in very remote rural regions. It's hard even for them to get to Lima to their appointment. So it's important that the hospital can reach them conveniently. For example, if they have digital technology, then they'll have to come into Lima to the hospital less often. A third point is that we need to provide effective communication in Spanish. But also on top of that, about over a quarter of the Peruvian population speaks a first language that's not Spanish. And these non-Spanish speakers typically live in more remote areas where healthcare is anyway very difficult to access. And a final point is, as Michael said, many rural people use traditional Peruvian medicines, or they may have a different diet based on more traditional foods. So the healthcare education that you and advice that you give these patients needs to take this into account. Now that we've understood the needs of Detector Clinic and other hospitals, let's turn to the technology and see how this meets the needs that we identified. You're probably familiar with ChatGPT and other similar text generative models. These models are very powerful because, firstly, they understand language, ordinary language, as well as humans, either in documents or in speech, so they can hold a very fluent and fluid, natural conversation on any topic. Secondly, they've assimilated all the information that's on the internet, so they can give very good advice and guidance, better than many humans. And of course, they're multilingual as well, and they can talk in any language. So this already meets some of the needs that we identified in the last two slides. And we know people are already going to ChatGPT for healthcare advice, even though that's far from ideal, because there's actually many drawbacks with these generative models. The first point is, as I said, they've been trained on everything that's online, even Reddit, Twitter, and other sites. So they can't easily distinguish between fact and fiction, between what's true and false information. So this is obviously a huge problem for giving advice about a person's health. A second point is, these models don't have access to the care plan. They don't have access to your personal medical records, obviously for very good data protection reasons. And a third point is that as out-of-the-box solutions, they don't have persisting memory. So they can't, for example, remember the conversation from last week. They can't remember when your medical appointment is or what you said about it to them last week. So in the diagram here, you can see the data flow that we've got for text generation, which is very similar to the ChatGPT. But we need to build on top of this. So let's move on to the next slide. So what we do is we take this generation step and we add a further step, which is called retrieval. So the model is going to retrieve information before it generates this response to this patient. Where is it going to get the information from that it retrieves? Now, in the diagram here, you can see that the doctor or the healthcare team member loads up a lot of information, or they approve access to certain information. So it's like there's a big filing cabinet full of information with the hospital's own data or any other sources of data that the hospital's approved. And this could be proprietary and confidential on the hospital's own server and securely accessed. And the model's going to now use this information only when talking to the patient. You can sort of imagine it's like a doctor. A doctor will have a lot of background information, knowing how to talk English, knowing a lot of everyday information about the world. But when they give the patient advice and guidance, they're only going to use their own medical training and expertise. In the same way, the generative AI models are only going to use the information in this giant data store. Of course, there's still many challenges optimizing every step. For example, extracting all the information from this data. For example, some data may be in tables, numerical data, image data, different types of data to interpret. So here's some screenshots from the chat agent. This can be delivered either through WhatsApp, which is a very convenient way to deliver it because most people are familiar with using WhatsApp anyway. So it's not a learning curve to start chatting with the AI healthcare expert through your normal WhatsApp, just as you're chatting with a friend, or it can be delivered as a standalone app too, if the hospital prefers that. So here you see in the first example, the chat agent's quite careful to restrict the information and tailor the advice to the patient, saying only what the doctor would say to the patient. In the second example, we see that the chat agent is providing support, reassurance, healthcare literacy, health advice, and the right kind of guidance and support. But of course, unlike the doctor, the chat agent is there anytime, all the time, for as long as the patient might want to talk with it. A few more examples. In this third example, we can see that the chat agent can also provide an image. So we're sort of going a bit beyond what ChatGPT is doing by providing images. And this is very powerful in medical as well, because often the patient's wondering what's going on in my body. sometimes a picture says 1,000 words, so you can just show a picture and the patient will understand much better. But also should the chat agent should balance helpfulness with harmlessness as well. It shouldn't be too keen to provide a response the way maybe ChatGPT is, and start to go too far in terms of giving independent and autonomous medical advice. It shouldn't do that. And in this fourth example, you can see that obviously we have to do a lot of testing to ensure that the system can't be jailbreaked, or no malicious user can hack into the system and get access to information that they're not supposed to have access to. Right, so now another point is that another interesting area of AI research really is agentic AI. This is something a lot of companies are working on. Here, rather than a single AI agent, we have multiple agents, and they can coordinate with each other in a bit like the way human beings in a team would, maybe a team of employees or a multidisciplinary healthcare team would coordinate with each other. So they can respond to the user's request in a very flexible and adaptive way. They can reason through the problem, break it up into steps, and then the problem can be delegated to different agents, dividing the task as needed. So here you see an example of how that's being done in a kind of multidisciplinary AI team mirroring the hospital team. So, for example, what we can do is we can give each agent access to a specific role, access to specific online tools, specific knowledge, specific skills, maybe querying hospital databases, doing an internet search, and maybe even real-world actions. For example, making an appointment for the patient with the hospital, or ordering a prescription refill for the patient when their prescription is running low. And we can have an AI constitution as well, which explicitly sets out the values and principles that guide everything that the AI agents do. So this is like maybe a cross between a corporate mission statement and an employee code of conduct. So currently, healthcare teams across the world, really, we know they're facing increasing workloads in terms of patient needs, and also administrative burden is increasing. In fact, one estimate is that doctors spend about 10 hours a week doing routine paperwork. So agentic AI systems can act like additional employees, really. So they relieve the workload and free up time for doctors to spend on the value-add tasks with patients. Further, we know there's a huge amount of data that's already been collected or can be collected from smart watches or smart devices or smart medical devices. And at the moment, we're not really using this information for anything, but you can, because it's sort of like divided up into different data silos. But you can imagine that it can be used to drive new, intelligent, informed care protocols and care pathways, which may be bespoke or personalized to particular patients. So for particular patients, it's okay to come off the treatment plan early or to reduce the medication. Other patients needs to be extended. So we can learn from the data to drive the care pathways. So I've really given you a quick overview of some use cases for agentic AI and other frontier technologies in medicine. But what we're doing and what we want to keep doing is learning from healthcare teams like you. We want to continue to harness those latest developments in generative AI from the big companies like OpenAI, Microsoft, Google, and so on, to meet the specific needs and challenges of healthcare teams in Peru, Latin America, and elsewhere. I'll hand over to Michael now for the final slide.
Thank you very much, Peter. As Peter outlined, we've been developing a number of advanced artificial intelligence tools to support personalized healthcare at scale. And what we're wanting to do in phase 2 is to build on our phase 1 study, where it showed the promise of remote healthcare, digital health, and reach to the mountain regions in the rainforest, in addition to cities such as Lima, with a project which would be led by Claudia Sedano. She's there in their meeting room. You can speak with her. She's from the Detecta Clinic, and she's been putting forward an ethics approval application and working with us and the embassy and other key stakeholders across Peru and the wider region. So please feel free to have a conversation with the embassy staff and Claudia to see how you can join us on this journey, developing this artificial intelligence. I want to thank you all very much, and we look forward to seeing you in Peru. Thank you.
Muy bien, gracias Michael, gracias Peter.
Thank you, Michael. Thank you, Peter. Now we will start the second presentation. It's a startup called AI Rehab, specialized on intelligent devices based on augmented reality and remote sensors with proprietary technology to treat patients and their rehabilitation therapies.
Hello, my name is Mikhail. I'm the business development lead for AI Rehab. At AI Rehab, we develop hardware and software that gamifies physical therapy to keep patients engaged and uses AI and data collection to improve healthcare outcomes. Around 350 million people globally suffer from knee osteoarthritis. Up to 70% of these patients do not complete their rehab. We know that completing your rehab is essential for improved healthcare outcomes. Our first device, Slider, is a Class 1 medical device and is placed under the heel of a patient's foot. Slider keeps patients engaged with their physical therapy through turning their exercises into games and using sensors to collect data. Slider's not just pretty, she's got brains. There's a force plate and laser trackers that collects data on how accurately and frequently patients are carrying out their physical therapy. It then communicates this data to the clinicians, allowing for remote, optimized, AI-driven physical therapy. We use AI in a number of ways. Slider collects novel data sets from patient exercises in their homes. We use AI in integrating time series analysis, kinetic modeling, anomaly detection, clustering patient profiles, and predictive models. AI-driven rehabilitation can provide real-time solutions and long-term insights into patients' progress with physical therapy. This combination of machine learning and novel data sets can help create personalized rehabilitation plans, monitor progress, and adjust exercises to optimize recovery, all from the comfort of the patient's home. We stack up pretty well against our competitors. Slider is the only device that measures force and motion in the home environment. Slider is mobile, affordable, and avoids any medical complications. Our competitors include devices like Gait Labs, which are laboratory-based treadmills and cameras that watch people carry out their exercises. These are unable to be deployed in a home environment. Wearables are devices that are strapped to the patient's leg or arm. Again, these can damage the skin or cause medical complications like blood clots. And finally, kinetic devices, a camera motion tracking that watch patients carry out physical therapy at home. These are unable to measure force and are far less mobile than Slider. We have 27 patents across the EU and the UK. So we have patents in 27 countries across the EU and the UK. Slider is both registered design and trademark, and we also have patents covering future devices we plan to bring out. Slider is sold as a subscription as a service model. We're currently charging $80 per month for 6 months, and we're selling direct to hospitals and clinics. We have additional ability of partnering with health insurers to sell the compliance data that we collect, and further opportunities for gamification upgrades, group therapy, and AI insights. Our team is diverse and experienced. We have people from engineering backgrounds, data scientists, and sales leads as well. This is a track record of our success so far. In 2022, we carried out a real-world validation study in the NHS. In 2023, we began sales to the NHS. And in early 2023, we had a peer-reviewed publication that was published independent of ourselves. In late 2023, we engaged with Florida Healthcare and agreed a clinical trial with Brooks Rehabilitation, a major rehab center in Florida. In 2024, we have partnered with a Veterans Affairs supplier to supply into the US military, and we've been accepted to an accelerator in Canada, the TELUS Accelerator. We're very keen to work with any potential collaborators in Peru, especially considering the need for remote monitoring and the difficulty that patients can have with accessing their healthcare. So we'd be very much interested in speaking to either distributors or clinics that are keen to carry out trials. Thank you very much for your time.
Thank you very much. Now we will give the floor to AstraZeneca, with Mr. Muro, who will give his presentation on the hub.
Okay, perfect.
Okay. I think that when we hear about these great ideas, we have two questions. How can I contact these companies, or maybe with other additional companies? And the other question that would go about, I can have a good idea like this one. So then what to do? Where can I register this? How can I make this solution scalable? I'm Black Muro. I'm the governance affairs manager for Peru and Latin America. And today I would like to share with you why a pharmaceutical company is so much interested in innovation in these countries and actually around the world. We have a purpose, actually. We are a company which is a pharmaceutical company, knows that to be able to close these gaps, it is necessary. If we are innovating with the molecules and the treatments that we have, it is of the essence to interact throughout the whole journey of the patient. We might have innovative treatments, but know at the same time that we cannot have these treatments if we don't identify the gaps that are there in the diagnosis and treatment adherence, or even education and promotion. There are so many things which are lacking and many deficiencies that we have to face them. Well, next slide, please. Next slide, please. AstraZeneca is a company that I'm sure that you have heard about. It's part of a global network. I would like to invite you to take a look at this A-Catalyst network, which is interconnected of different actors that connects academia, it connects the industry, it connects startups and also the physicians, it connects patients, it connects finances, it connects people who work on technology, and it is a network that it's not just a corporation. It's looking for activating an innovation ecosystem to be able to develop and work on the solutions that will activate this ecosystem to identify those peoples and those startups that we've heard about with solutions for problems that we have today, to bring solutions to our daily problems, but also problems like in the first case that they were speaking about cancer and a language problem that we might have with Quechua or Aymara, those languages that are spoken in remote areas. Or the second solution that's about finding a solution for knee problems. We have complex problems from the health perspective, and we might have solutions for simple things like having an aid for our knee problems. So AstraZeneca is looking for the power of collaboration based on the know-how that we have, local know-how that we have in each one of our countries, but working with collaboration through the experiences that we have in those places where we are. What we are looking for is to create possibilities and impact. We are striving to work under collaboration. We work at the innovation centers that we have for more than 5 years around the world. I lost the presentation, Santi. We are around the world, and in fact, we have more than 25 hubs in the world in the different countries. And we have the innovation hub in Peru. We have an innovation hub in Ecuador for 1 year. We've been having a hub in Colombia for 3 years, also in Brazil, in Mexico, and the Southern Cone in Central America. But we also have 9 hubs in Europe, 1 in Africa, 1 in Oceania, 8 hubs in Asia. So we are an interconnected network that is looking for bringing on knowledge. In Peru today, we have 2 solutions, and not only solutions that are local, but we have one AI solution in India to work on reading X-rays. It's not the only one. We have plenty of them. Not only one in India, but we also have local solutions in Colombia working with AI for predictability of chronic renal disease, but we are also interested in promoting local talent. Next one. We have scheduled activities that are looking for developing solutions, and we are doing this in different ways by creating alliances and activating the ecosystem, by lobbying on public policies, and also working collectively in discussions 1 year ago. And I think that Peru is one of the a few countries which issued a law that is looking for or promoting the use of AI for the development of the social development of this country. And this, of course, encompasses health. This was a work that was very well promoted by the Ministry of Health, and this is something that we need to acknowledge. And I've been working from the Secretariat on the regulations. And I think that this is part of the challenge that we have as a country. What happened 1 year after that we are not implementing this? And this is not AstraZeneca per se. This is a network, and we would like to join efforts with the public and private agencies. We have allies in this innovation hub. We work with academia. We work with different health institutions. We have worked in collaboration with the Ministry of Health, with the social insurance and the social security. We want to activate the system. We want to work on these issues definitely. So we are also looking for other ways to activate this ecosystem. And very recently, we have launched our first program on mentoring at the LATAM level. Next slide, please. And this first mentoring program resulted in 30 startups, which are being part of this mentoring plan. 30 startups from 10 countries, which have a program that will last for 3 months. This is a mentoring program with 6 modules, where mentors from the company, from all of the Latin American countries, provide modules where we dive into the health systems of each of the countries. We dive into the access existing in each of these countries, alliances, scalabilities. We have allies like Google to provide specialized know-how. AstraZeneca is not financing these development programs. We want to be an ally to articulate with the different actors and stakeholders. We want to generate spaces like these to make this visible. We want to network with other Latin American countries. And another example is the private and public alliance like the Programa Más Salud en Comunidad, Community Program Plus Health. It has an impact. It's looking for more coordination in vulnerable areas. What do we do, or what do we want to achieve? Health equality by closing the gaps with digital health. We know that digital health involves AI, education, solutions, and we have managed through the Innovation Hub to put a project in motion, and I would like to share with you a video. I don't know, Santi, if we have our video ready.
No tiene audio.
There's no audio here. This is a program that we presented as the hub. It's the second year that we've been accompanying the Technology Council. They developed a project this year, and we presented this project together with the regional government of Cajamarca, where we developed this project. It has different alleys. It's connectivity first. When we talk about digital health, we have to think about connectivity. When we speak about AI, we need to reach vulnerable and remote people, and we need to think about connectivity. We have alleys with medical devices, telehealth, and this is the project that we have presented.
No tiene volumen, Santi. Páralo, Santi, porque no se escucha el video, no sé. André, no sé si es aquí que hay que configurar.
I don't know if where they are trying to set the video up. I'm sorry.
Hola, ¿qué tal? No sé si me escuchan. Yo estoy
I don't know
compartiendo
if
audio.
you can hear me. I'm
Por
sharing
favor,
my
me avisa,
audio,
¿listo?
so please let me know.
Sí. Tú estás con audio, compartiendo audio, pero no se escucha tu audio.
We cannot hear your audio, Santi.
Creo que aquí tienen que poner el
Tienes
tipo
que
de audio. Andrea lo está
colocarlo
poniendo.
en optimizar para video.
Ok, si quieren voy a volver a compartir y
I would
lo
share
miramos.
it again, and then we'll take a look at the video.
La opción de compartir, la opción de optimizar para video.
They are trying to solve this technical issue.
Esto es parte de la tecnología. Si no viviéramos en un mundo como ese, la tecnología
This is
no
part of
mataría,
technology.
¿no? Entonces, esto es parte de la tecnología.
This is part of technology. Imagine if we didn't have these type of issues, we wouldn't get better.
Santi, tienes que poner optimizar para video cuando lo compartas.
Sí, justo ya le había dado la
Yes.
opción. ¿No lo escucharon ahí en esa última
Didn't,
prueba?
were you able to hear the
Bien, voy a
volume?
probar una vez más.
I will try once again.
André, tú no sé si cambiaste aquí los altavoces, no tienes, pero creo que tienes que volver a poner de repente los. Bueno, este es un proyecto, además, que tenemos trabajado y que empezó.
This is a project which started already some months ago, and what it looks for is to show a hypothesis, not only bringing digital health. Well, today we are working on telemedicine. The institutions are working with telemedicine. I'm sure Dr. Rojas will correct me, but there is a telemedicine network, right, doctor, at the national level. However, there's something that we realized. Recently, I personally had the chance to go to the area that we will have this intervention. It is a place that's 7 hours away from Cajamarca, from the city of Cajamarca, and to get there it isn't easy. I cannot imagine someone with appendicitis to leave this place and to go to a health post. I cannot imagine if someone is a woman like me, and what if you feel something? You don't know what having like a bump on your body would mean, and you get there and you have to learn how to touch your breasts, but maybe if you found something strange, you wonder what to do. If I feel a lump, what to do? I need to take a car or some type of vehicle that will take me to this town to see if I can have someone who can send me or refer me somewhere that can see me that same day. And it's actually a lot. So
Saludable comienza con un diagnóstico.
And then I need to think about the time that will go by until I'm finally referred to an expert. And then I have to think about someone who can give me a confirmatory test and then come back again to see if I received treatment. This is why the mortality index is so high in Peru. I think that the level of mortality might be under-registered. And this happens when this is silent. This is a silent reality, a reality that we don't know. So I personally went to this place, and this is not to mean or not to say that I know all the realities, but this was actually very shocking to me, and I cannot imagine what happens with children that I saw there, which might be malnurtured or anemic, and this is the future in Peru. So I think that there's a lot to do, and we have to look for solutions, and we will be able to close gaps. And I think that articulated work can help us close gaps in the short term. Let's see if we are lucky, Santi. A healthy society starts with timely diagnosis and equitable access to clinical care. In Peru, many vulnerable communities are facing challenges to have access to health services, and at AstraZeneca, we are committed to taking innovation to all of our patients. The project has 4 alleys. This is a project which has Ispasat, who's a public capital company in Spain. I'm sorry, but they are playing the video and she's speaking at the same time.
Más salud en comunidad. Y empezamos en Cajamarca, Perú. ¿Por qué Cajamarca? Cajamarca tiene una población de 1.7 millones de personas, siendo la región más pobre de todo el país. Una comunidad vulnerable, pero con una gran voluntad de mejorar sus condiciones, con un grupo de profesionales comprometidos con el desarrollo y la adopción de nuevas tecnologías que beneficien a miles de pacientes, porque saben que es la única forma de cerrar las brechas en salud y desigualdades de la región. En una alianza de AstraZeneca, Ispasat, Salud y la Dirección Regional de Salud de Cajamarca, llevaremos conectividad, telemedicina, educación y soluciones de inteligencia artificial para el diagnóstico de patologías crónicas y oncológicas a Cortegana y Solendín en Cajamarca. para contribuir a la prevención y al
lo que
diagnóstico
buscamos
temprano
justamente
de
es
su
trabajar en
población.
prevención y diagnóstico
Distribuiremos una
temprano.
solución de
Porque
telemedicina
cuando uno
compuesta de
piensa
una
en
avanzada
el sistema
conectividad
de salud y
satelital
las
y un
enfermedades
sistema de
crónicas, y
equipos
eso fue
médicos de
espectacular,
fácil
lo hizo
manejo para centros comunitarios
Hernán
en
a
zonas
través de
rurales,
Perú
que
Sostenible,
posibilita
trabajó este
consultas
año
médicas de
para
alta
trabajar
calidad
un
con
proyecto
hospitales a distancia,
precisamente
facilitando diagnósticos y seguimientos sin necesidad de traslados extensos.
en todo el tema de
Todo
enfermedades
esto de la mano de la
crónicas, que es la enfermedad
implementación de
crónica hoy día. ¿Por qué
soluciones de
está tan
inteligencia
colapsado el
artificial del
sistema de
Centro de
salud?
Innovación.
Justamente porque no trabajamos en enfermedades crónicas no transmisibles
We do
degenerativas.
not working in non-transmissible
Hacemos un
diseases,
seguimiento,
so
no
we
hacemos un
don't
trabajo, y
provide
siempre nos
follow-up.
efectivamente alrededor en estos lugares al final
And this is something that happens in these areas where they have
enfermedad
respiratory
renal crónica.
diseases, diabetes,
Solo para decirles un
chronic
dato,
renal
la
disease.
enfermedad renal
For
crónica
example,
es
chronic
consecuencia
renal
del
disease
manejo de la diabetes o de
is a result of the
hipertensión
poor
arterial.
management of diabetes or hypertension,
Y es probablemente
and it's
lo más
perhaps
costoso para el país. Un dato
the
para
most
soltarles,
expensive for the country.
lo que gasta salud y el
How much
MINSA
they
para
spend in health
aproximadamente
for approximately
16.000 y 17.000 pacientes.
16,000
Estamos
patients.
hablando de
We're talking
unos
about
500 millones de soles.
500 million soles.
500 millones de soles, si no es un poco más.
500 million
Imagínense si
soles.
pudiéramos hacer educación y
And
prevención destinada
if
a
we
este
could
porcentaje,
provide information and prevention
para poder mejorar
and
estilos de vida
follow up
saludables, para poder
to
empezar con
have
la
healthy
prevención de estos
practices.
proyectos. Entonces, hay mucho trabajo por hacer si pudiéramos
So
utilizar la
there's a
inteligencia
lot to
artificial,
be
si
done
pudiéramos
with
utilizar
international, with
estadísticas, si pudiéramos
artificial
generar.
intelligence and
Este programa de Más
technology.
Salud en Comunidad, eso es
And
una
this
cosa
is a
que
program
justamente
called
hablaba con un
More
psicólogo
Health
no
in
hace
the
mucho.
Community.
Eso es lo que buscamos, articular
This
actores
is what we are
que
looking
puedan
for to coordinate
trabajar
efforts,
salud digital desde la
work
perspectiva de salud digital.
with public
Entonces,
health.
qué pena que no se haya
So,
podido escuchar el audio.
fortunately,
Pero
you
bueno,
couldn't
parte de la
hear
idea era
the
mostrarles
audio.
estos
The
proyectos
idea
que
was to
hacen
show
el
you
Centro de Innovación como nosotros, más allá
projects
de
of
ser
innovation like we do. And AstraZeneca is a coordinator.
es un articulador para
It's
que
a
el ecosistema
coordinator
tome vida propia,
for the
que
ecosystem
podamos
can
generar un
work
ecosistema
themselves
que tome la vida propia, que gane legitimidad por sí mismo,
to
¿no?
become
Creo que
legitimate
la
by
industria
itself.
tiene un rol, pero no solamente la industria es un promotor porque busca justamente trabaja en
In
investigación.
having the industry just a promoter.
Aquí están los pacientes, aquí están
And we
los
have the
profesionales de
startups,
salud,
we
los
have the
médicos, las
patients,
enfermeras, aquí están las instituciones de salud que son
physicians,
clasificadas,
nurses,
aquí
and the
están
public and
los
private
equipos.
medical institutions.
El llamado del día de hoy es que
We make a call
necesitamos
today
articular el
that
ecosistema
we need to coordinate the ecosystem.
logremos
The
generar
calling
una relación de
is
confianza
to generate a trust relationship.
a
At the end, what gets all of us together, all the stakeholders,
porque creo
is
que
a
al final
health.
paciente podemos ser todos.
Because at the end, the patient is the most important. Thank you very much.
Ay, perdón, falta una adicional, solamente no quería, creo que es
One
una
more
introducción.
slide.
La próxima semana, el día 19 de
Next
septiembre,
week,
vamos a tener justamente,
September
y hablábamos
18,
con la embajada de
19,
tenemos un
we
evento
have
que va a ser un
a
foro de salud digital, tenemos el Peru Health
digital
Summit,
health
vamos a tener un
forum,
evento muy
Peru's
bonito
Health
que
Tech Summit,
coordina la puesta en marcha
an
y
event
el
of the
exterior de nuestro
startup
proyecto de Más Salud en
of
Comunidad en
our
Cajamarca.
project More Health in the Community in Cajamarca.
Este evento, además de poder celebrar
And
2 años
in
del Hub de
addition,
Innovación,
we're going to
con uno de
celebrate
nuestros
2
aliados,
years of the
la
hub.
Embajada Británica. Así que tendremos
So we're going to
un par
have
de horas simpáticas
a
con
couple of
expositores que van a hablar y
nice
profundizar un poco
hours
más
with
de los
speakers
enfoques. Así
that
que
are going to talk about
muchas
digital
gracias
health.
por la invitación.
Thank you very much.
Bueno, muchas gracias, Blade, por tu presentación.
Thank you
Y
very
como
much for
último,
your
también
presentation.
de
And
iRehab nos querían mostrar un
finally,
video sobre su dispositivo que
there's a
funciona.
video of
¿Qué
their
les parece?
device to finish this presentation.
Esperemos que con audio. Listo. Muchas gracias, Shamin, por el video.
Thank you very much, Shamin, for your video. So we conclude with all the presentations. I hope you enjoy them. Any questions for any of the companies, you can contact us and we will connect them with you. Thank you very much again for your time, and I hope that you find this meeting useful. Now we have a coffee break, and then we will continue with our discussion. Thank you so much. I think we're done.